Okay, Wade, what we want to show here is how to get the sample, but also why to get the sample for the new molecular cultures. Chronic wounds are basically just chronic infections, and the basic tenet of medicine that it's been built on is you diagnose and then you treat. You don't want to just be doing trial and error, and unfortunately, that's the way most chronic infections are dealt with in general. And wounds specifically, it's basically been trial and error because we haven't really understood what's going on the surface of the wound. And now this molecular cultures are going to change all that. And first thing we're going to do is demonstrate how we get a swab culture. We want to clean the surface. We want to make sure it's free of any skin contaminants, any fecal contaminants, any environmental, because these are extremely sensitive cultures. And we want to get the bacteria that's on the surface of the wound. Now, I'm kind of biased against swab cultures, but they're easy to do. The technique is you want to roll the entire swab on the wound. You want to get a little bit of pressure and drag it across. But even though you don't see a lot of debris on the swab itself, it's still picking up enough bacteria that we can diagnose this, and it correlates good enough. But the technology or the technique that I really like to use is either the debridement or the biopsy culture. That's where we get the biofilm or the bacteria that's up close to the host, and it gives us a little bit better, a more robust picture of what the microbiology is along the wound. So what we really want to do next is show you the process of analyzing these cultures so people can understand a little bit better what kind of samples we need and just the amazing capability of the new molecular techniques.
Hey, we're here at the lab underneath the Wound Care Center with Dr. Scott Dowd. We're going to go step by step, look at each individual process that we do at the lab here for the Wound Care Center. And so, Dr. Dowd, let's go take a look and get started and see what's going on.
Let's do it.
Dr. Dowd, here we are at the lab portion of the Wound Care Center here in Lubbock, and a lot of amazing technologies are being produced right here in-house, which I found just absolutely fascinating. But at this particular station, Dr. Dowd, what is it that we're seeing here, and what exactly is going on?
Okay, so as we're developing technologies, we're trying to combat older technologies and improve them. So what we have here at this station is an older technology called culturing. So what this does is actually enables the bacteria that are pathogenic to grow on a plate, and therefore we can amplify them and determine biochemically what they are. This is a technology which is hundreds of years old and in fact takes several weeks often to identify which pathogens are actually there. So our goal here is to develop improved methods where we can diagnose these patients, tell them which pathogenic bacteria are causing their infection, and we can do it in a rapid manner, maybe within an hour or two.
Well, Dr. Dowd, if, as you say, this is more of the archaic ways of doing things with the cultures and the agar cultures and things like that, people might be wondering, watching the television show, saying, well, why do you still have that in the lab if it's such outdated technology?
It comes back to perception and acceptability. So this is an older technology, but it's accepted. And so physicians, scientists, they accept this technology as a standard. And so what we're doing as we improve and our technologies increase is setting new standards. So as new standards improve and increase and become valid, then they will take the place of this. And so you will see a decline in the use of clinical microbiology culture for many, many applications. We use different types of media with different types of nutrients. And this is one of the problems with the technology, is that certain bacteria require certain biochemicals, certain nutrients in order for them to grow. And so we have to carefully choose which media we use in order to grow the bacteria that we're looking for. And so here we see two different types of media which have very different nutrient characteristics, such that the one is maybe an enrichment media and the other is a selective media or an indicator media. The indicator media may change the bacteria a different color to indicate which bacteria it is.